We've all felt something of the stress, the isolation, the anxiety caused by the pandemic. For those waiting for a life-saving organ transplant, COVID-19 meant a shortage of hospital beds, fewer donors, and more worry.
But doctors at the Sentara Transplant Center say the challenges of the virus also created some opportunities. A challenge an ODU professor found himself right in the middle of. The road to the OR for a transplant patient is a journey filled with waiting and worrying. The pandemic a roadblock to the hope the gift of life can bring.
It complicated things enormously.
Dr. Harlan Russ says hospitals filled with COVID-19 were no place for transplant patients with suppressed immune systems. Living donors stayed in their bubbles. During the pandemic, kidney transplants at the Sentara Transplant Center dropped by a third, mirroring a national trend.
There was no bed to put a transplant patient in, even if we could give them the organ.
Despite the risk, Steven Morrison, an ODU professor, needed a new kidney, and soon.
It was always on the cards, but we were hoping, you don't know how quickly the disease is going to progress.
Morrison would take a whack to the back in a soccer game, revealing he had polycystic kidney disease.
It was like a car I couldn't get out of third gear.
His sister was a match.
Had to be done, and it's a lifetime experience for me as well, which I'll cherish that I was able to do it for him.
Leslie Jenkins was willing, but she was 9,000 miles away in New Zealand, a country with a completely different healthcare system. While COVID-19 presented challenges for organ transplants, it also created opportunities. When the pandemic hit, Sentara had just begun to build a sophisticated telehealth network. The setup allowed Leslie's doctors in New Zealand to coordinate with Sentara, limiting her exposure to COVID.
I had a major Zoom call, and I had I think 6 different medical professionals talking to me.
Planes, trains, and automobiles, and a host of COVID tests later, Leslie was in Norfolk for the surgery. She jokingly remembers a curious security guard in San Francisco.
I'm bringing my kidney for my brother, and the guy just suddenly looked up at me and went, "What?"
Soon, brother and sister donned surgical caps and gowns.
Having that time with Steve when we were recuperating was just a really great connection again, back to the things that we do as a family.
It's really quite remarkable, the miracle of this surgery. And yeah, so I think I'm pretty blessed.
Steven Morrison is a pandemic transplant success story. But doctors at Sentara say the mortality rate of kidney transplant patients with COVID was much higher than ordinary people. And while the risk appears to be low, doctors say they are watching whether COVID-19 can be transmitted through a donor organ.
In the current level of COVID, I think we should be transplanting as many people as we possibly can, just keeping in mind that virus is still around, but we have a lot of tools and a lot of knowledge now that we didn't have before.
Now, Steven Morrison did get COVID-19 last fall. Knocked him for a loop, he told me, but as he said, he is doing great. If you'd like to hear my complete interview with Steven and Leslie, head to 13newsnow.com.
Oh, what a nice story.